Okay, so welcome to this next video. In this video, what we're going to talk about is Parkinson's disease, okay? And we're also going to talk about the anti-Parkinson drugs, okay, which are the drugs used to treat Parkinson's disease. So the title for this video is Parkinson's disease and anti-Parkinson drugs. Okay, right, so the structure then for this video is we're going to start off by talking about the different symptoms of Parkinson's disease. Okay, we'll look at the motor symptoms, which are the most famous symptoms of Parkinson's disease, and then we'll talk about the non-motor symptoms as well. Okay, then we'll turn our attention to looking at the neurodegeneration which underlies Parkinson's disease. Okay, so Parkinson's disease, fundamentally, it is a neurodegenerative disease. Okay, neurons are going to die due to aggregations of protein. Okay, and we're going to look at which protein it is that is aggregating in Parkinson's disease. Okay, this will also allow us to talk about hereditary forms of Parkinson's disease, which are very, very rare, but they do exist. Okay, most forms of Parkinson's disease are sporadic forms, okay, which we think may be caused by environmental factors such as chemicals, for instance. Okay, but we'll come to that when we discuss the neurodegeneration. Okay, then what we'll move on to after the neurodegeneration is we'll look particularly in detail at how the motor symptoms of Parkinson's disease arise. Okay, because this is quite well understood. We will look at the degeneration of the substantia nigra pars compacta and the dopaminergic neurons in there. We'll look at what their function is in health, and then we'll see how once they're gone, this is going to lead to some of the motor symptoms of Parkinson's disease. It's going to lead to the cardinal feature of Parkinson's disease, which is that you have an inability to initiate voluntary movements. Okay, but even that in detail discussion is not going to be able to explain other features of Parkinson's disease. Okay, right. And then finally what we'll come to is the anti-Parkinson drugs, which all work merely to treat the problems with initiating voluntary movements. Okay, they do not stop the neurodegenerative process, and they do not get rid of the other symptoms of Parkinson's disease, as we'll see. Okay, so that's the structure then for this video. So what we're going to start off then with is the symptoms of Parkinson's disease, both the motor symptoms and then the non-motor symptoms. So the symptoms of Parkinson's disease were first outlined in 1817 by James Parkinson himself, the person whom after the disease is now known. Okay, right. So we'll start then with the motor symptoms, and we'll start with the cardinal motor symptom. Okay, so the most important motor symptom. Okay, so motor symptoms then. Okay, so the cardinal motor symptom of Parkinson's disease, if there's one symptom that you should remember, and you will remember by the end of this video, because we are going to see a really beautiful theory for exactly where this symptom comes from. Okay, it is the symptom of hypokinesia. Okay, so what does this mean? Well, kinesia means movement. Okay, so let's underline kinesia. So kinesia means movement. Okay, hypo as a prefix means too little. Okay, so too little movement, and specifically hypokinesia means impairment of voluntary movement. Okay, so difficulty in initiating voluntary movement, impairment of voluntary movement. Okay, so basically people with Parkinson's disease find it really, really difficult to start moving, basically. Okay, whereas normal healthy people can just initiate movements easily. People with Parkinson's disease have to really, really concentrate to try and actually start moving. Okay, it's really, really hard work to actually move once you've got this disease. Okay, and we are going to see a very beautiful theory for exactly how this symptom arises. Okay, Now, there are other motor symptoms of Parkinson's disease which aren't going to be as beautifully explained by the theory that we are going to look at in a huge amount of detail. Okay, but are nevertheless important features of Parkinson's disease as well. Okay, so another one is bradykinesia. Okay, now bradykinesia means that once you actually do start moving, your movements are very slow, so that's what brady means. Okay, brady means slow. Bradycardia, for instance, means that you've got a slow heartbeat. Okay, so slow movement. So when you do actually move, your movements are very slow. Okay, right. The next motor symptom then. The next motor symptom I'm going to talk about is muscle rigidity. Okay. Now, what does muscle rigidity actually mean? Well, this means that if you try and move someone's arm, let's say, with Parkinson's disease. So let's say you ask the patient to sit down, okay, and you're now going to try and move their elbow, okay, so you're going to try and, let's say, flex their elbow, okay. It will be really, really difficult to move their joints, basically, because their muscles are so tense. So let me draw a little picture for what I'm trying to describe. So let's say this is your arm here, okay, and, well, this is your patient's arm, okay, and what you're going to do is basically just move the joint of the arm, move the elbow, okay, so you're going to extend the joint, and then you're going to flex the joint, extend the joint, flex the joint, but you are going to be doing the movement, okay, you're not going to get the patient to contract their muscles, okay, you're just going to be trying to passively move their arm joint. Okay, right. Now this will be really, really difficult to do in a patient with Parkinson's disease because their muscles are really, really rigid and will resist the movement hugely. Okay, so that is what is meant by muscle rigidity, that the muscles have all got too high tonic contraction levels, basically, which means that actually moving a joint like this is really hard work if you're doing it passively. Okay, right. Then another important symptom is tremor, okay, and the specific tremor that people with Parkinson's disease generally get is a tremor of the hand, okay, so tremor is an involuntary quivering movement, okay. Now the tremor that people with Parkinson's disease get is described as a pill rolling tremor. Okay, so let me try and show you this. So basically what it often looks like is something like this. Okay, so generally the hand will be shaking like that, and then also the thumb will be moving like this, okay, as though they're trying to roll a pill around between their fingers. Okay, so it's called a pill rolling tremor. Okay, and that's a very common symptom. And again, our theories regarding the loss of the dopaminergic neurons in the substantia nigra pars compacta, they're not really going to explain brilliantly why people with Parkinson's disease get tremor. Okay, really, that specific little aspect of the theory of Parkinson's disease is going to really explain hypokinesia beautifully. Okay, the other portions are less well understood and are probably related to neurodegeneration that's occurring in other portions of the brain, not just the dopaminergic neurons of the substantia nigra. Okay, right. Next motor symptom, which again is very distinctive, is that people with Parkinson's disease have a very characteristic shuffling gait, as it's described. So gait just means how you walk. Okay, shuffling means that the little footsteps are tiny and they kind of shuffle forward. Okay, so very small footsteps, and it really does look as though you're just sort of shuffling forward. You're not actually walking almost, you're shuffling. Okay, so this characteristic shuffling gait that's seen in Parkinson's disease. Okay, and then the final motor symptom that I want to talk about, and you could go on, you can put more and more niche ones down. These are the main ones that I'm going to tell you about. Okay, the final one I want to mention is that generally you end up with quite a flexed posture. Okay, and that's the nice way of saying hunched over, basically. So generally they end up sort of hunched over. Okay, so this means hunched over. Okay, right, because of odd muscle tone as well, so this is related to muscle rigidity. Okay, so the muscles that control your posture, there's something wrong with their tonic contraction, okay, and it leads to this flexed posture overall. Okay, right. So those are the motor symptoms then of Parkinson's disease. Now what I want to mention is the non-motor symptoms, because these are important as well. Okay, these like some of these other motor symptoms, some of these motor symptoms besides the hypokinesia cannot be explained merely by the neurodegeneration of the dopaminergic neurons of the substantia nigra pars compacta. And that's why it's important to realise that Parkinson's disease is not just about losing the dopaminergic neurons in the substantia nigra pars compacta. Okay, people often focus on that because there is such a beautifully well understood theory regarding that and how it causes the hypokinesia. Okay, but in fact Parkinson's disease is a widespread neurodegenerative disease like Alzheimer's disease, okay, and Huntington's disease, okay, and it causes a huge number of other side effects as well. Okay, and some of these other motor ones will be caused by neurodegeneration outside of the substantia nigra pars compacta, and these non-motor symptoms that we're talking about here are certainly going to be caused by neurodegeneration outside of the substantia nigra pars compacta. Okay, so the non-motor symptoms then of Parkinson's disease. Okay, so a key one then that gradually progresses as the disease progresses is dementia. Okay, so what does dementia actually mean? Well, dementia basically means that the brain is starting to deteriorate, basically. Okay, loads of important things start to deteriorate. So, for instance, memory starts to deteriorate. You start to lose your memories. Okay, in addition, your personality starts to be lost, okay, or change at least. Personality changes, okay, in addition, cognition goes, so your cognition begins to fall. Okay, so loads of important things start to collapse in dementia. Okay, it's a broad term that covers all of these things. It's the brain breaking, really. Okay, so that's one of the things that gets gradually worse as the disease progresses, and that's understandable. It's a neurodegenerative disease. It's causing neurons to die all over the brain. It's going to cause loss of loads of things that the brain does, including memory, personality, and cognition. Okay, right. Other things that can result are you can become depressed. Okay, so the cardinal symptom of depression is dysphoria. Okay, so a really bad mood, basically. Not feeling happy, either feeling angry or irritable all the time or feeling sad. Okay, so dysphoria. And then finally, another non-motor symptom that I want to talk about is problems with the autonomic nervous system. Okay, autonomic disturbances, I'll call them. Okay, now there is a fancy word that means autonomic disturbances, okay, and this is dysautonomia, okay, so whenever you see dys in front of something, it means something's gone wrong, okay, and then we've got autonomia, okay, so dysautonomia, okay, which means that the autonomic nervous system is having problems. Okay, now what sort of things can this actually cause? Well, the autonomic nervous system controls a huge number of different things, okay? So, for instance, it controls the cardiovascular system, okay? So, if you get problems with the autonomic nervous system that is controlling the cardiovascular system, one of the things that can actually commonly end up happening is you get orthostatic hypertension. Okay, so this is one of the things that can result due to Parkinson's disease. Now, what does orthostatic hypertension actually mean? Well, it means that when you stand up straight, okay, that's why it's orthostatic. Okay, so when you suddenly stand up after sitting down for, let's say, quite a long period, okay, what will happen is you'll get hypotension. Okay, the blood reaching your brain will suddenly go down. Now, usually in a healthy person, when the autonomic nervous system is functioning correctly, okay, the autonomic nervous system deals with this, okay? It causes muscles to contract surrounding the blood vessels appropriately so that blood supply to the brain doesn't fall. If you've got problems with the autonomic nervous system, then basically you don't get the appropriate response on the level of the autonomic nervous system to suddenly standing up. Okay, the cardiovascular system doesn't adapt to the new position, okay, and blood flow to the brain, well, it doesn't adapt to the new position quick enough. Okay, and now less blood is going to go back to the brain, which means that you end up fainting, basically. Okay, so orthostatic hypertension is one of the side effects of Parkinson's disease resulting from dysautonomia. Okay, another side effect of the autonomic nervous system going bad is gastrointestinal side effects. Okay, so the autonomic nervous system also hugely innervates the gastrointestinal system. Okay, so a symptom that you can present with is constipation. Okay, and then finally, another one involves the urogenital system. Okay, and a complaint that can occur is what's known as nocturia. Okay, now nocturia just means having to get up in the middle of the night to urinate. Okay, so that's another thing that can result because of problems with the autonomic nervous system, because the autonomic nervous system is involved in controlling when the bladder detrusor muscle contracts. Okay, right, so all of those are side effects which can occur because of problems with the autonomic nervous system. Now, why can Parkinson's disease cause problems with the autonomic nervous system? Well, again, if the neurons that are involved in controlling the autonomic nervous system degenerate, then of course it makes sense that you're going to get autonomic disturbances. Okay, right, so let's go over on to the next page, and let's now begin our discussion of the neurodegenerative process that underlies Parkinson's disease. Okay, so neurodegenerative processes then, they result in neurons dying, okay, and the main neurons that are going to be affected by the neurodegenerative process in Parkinson's disease are the dopaminergic neurons in the substantia nigra. At least that's what's going to give this cardinal motor symptom of hypokinesia. Okay, but neurodegeneration is occurring all over the brain in Parkinson's disease, and this is what results in the other symptoms of Parkinson's disease besides just that cardinal motor symptom of hypokinesia. Okay, right. And it's also important to say at this point that the anti-Parkinson drugs, okay, are all just going to replace dopamine. Okay, they're sometimes called dopamine replacement therapy, and that really is all they do. They replace the dopaminergic signal, okay, which then gets rid of the hypokinesia, and it really does work fantastically. It gets rid of the hypokinesia fantastically, but it doesn't treat some of the other motor symptoms of Parkinson's disease that aren't caused by the reduced dopamine released by the substantia nigra pars compacta. Okay, and it certainly doesn't treat the non-motor symptoms, which again are caused by neurodegenerative processes occurring in other areas of the brain. And finally, unfortunately, it does not actually stop the neurodegenerative process, so it doesn't stop the underlying pathological process progressing onwards, which means that even when you're taking anti-Parkinson drugs, the disease is still getting worse and worse and worse, and that's why often people taking drug treatments such as levodopa, okay, and we'll come on to that later on, often they stop working eventually as the disease progresses. Okay, right. So, now then, let's actually discuss the neurodegenerative process then that underlies Parkinson's disease. What is happening in neurons that is going to kill them? Okay, so, basically here is where we get clues from hereditary Parkinson's disease. Okay, so firstly I need to tell you about the difference between sporadic Parkinson's disease and hereditary Parkinson's disease. So you have sporadic forms of Parkinson's disease and hereditary forms of Parkinson's disease. Now, sporadic forms occur in the general population where there is no genetic cause of it, okay? At least there's no genetic cause of it that they've had since birth, okay? It doesn't mean that in neurons there couldn't be mutations that have occurred, okay? But at least in the germline they do not have mutations that predispose them to Parkinson's disease. And by the words in the germline, what I mean is in their reproductive cells they are not going to have mutations that predispose their children to have Parkinson's disease. Okay, so when they were born, or for instance when they when those people were just a fertilized egg, they did not have a mutation that was predisposing them to Parkinson's disease. It doesn't mean that later on in the brain a neuron didn't acquire a mutation. That's a different thing. Okay, that would be a peripheral mutation rather than a germline mutation. In contrast, people with hereditary Parkinson's disease, they have got a mutation from birth which is going to mean that they are at risk of developing Parkinson's disease. Now, people who are going to get sporadic Parkinson's disease, generally it occurs after 60. Okay, so you are generally older than 60. Okay, in hereditary forms of Parkinson's disease, this age of onset can be much younger. Okay, in some forms of hereditary Parkinson's disease, the age of onset can be at 3 years old, so you develop it much quicker, basically. Okay, right. But what's nice about the two forms of Parkinson's disease, the sporadic and hereditary forms of Parkinson's disease, is that both seem to involve the same pathological process which is causing the neurodegeneration. Okay, and this pathological process is going to involve the protein alpha-synuclein. Okay, right. Now, I'm going to call it there for this video, and we'll continue this discussion in the next video.